And thanks for joining me as I discuss an analysis of the effect of a COVID-19 road closure on pedestrian and bicyclist usage in Philadelphia, Pennsylvania. My name is Will Cowan, and I am a senior traffic engineer with WSP out of the Philadelphia, Pennsylvania office. There will be time for questions at the end of the presentation. Please add your questions to the question box. You can also download the presentation and the white paper in the handout box. Prior to joining WSP 3 years ago, I worked for consultants and the state DOT in Baltimore, Maryland. I would like to thank several partners that contributed to the underlying study. Imperial Traffic and Data Collection for assisting with the data collection, and Chris Blakely and Liz Andrew, both WSP employees, for assisting with the analysis and QA/QC. As I introduce the study, we'll note some other street closures at the onset of COVID-19, and then review the Martin Luther King Jr. Drive corridor and the petition that led to the closure. Prior to the data collection, I developed some study questions which guided the analysis of the data. Findings and interpretation of the results will follow, along with a short introduction of the methods for calculating pedestrian and bicycle level of service. To expand on the agenda a little bit, we'll highlight that the city of Philadelphia was one of many worldwide cities that closed streets to vehicular usage and opened them up for recreation. Not to give too much away, but our analysis of the data didn't exactly show the results I was expecting. For those engineers, planners, and advocates on the call, we know that we utilize vehicular level of service all of the time, but have you ever been scoped to analyze pedestrian, bicyclist, or shared use path level of service? Level of service is a qualitative measurement used to analyze a transportation mode. I want to highlight the powerful tools that are available in the Highway Capacity Manual, which are the bicycle level of service and the pedestrian LOS. At the beginning of the coronavirus pandemic, cities across the world started looking at ways to provide for safe outdoor recreation and multimodal transportation options as an alternative to mass transportation and driving. In Paris, over 30 lane miles or 50 kilometers were reserved exclusively for bicyclists, and 30 roadways were closed for pedestrian uses. In Baltimore, bottom center photo, streets across the city were closed and available for local traffic only. As cities started implementing these solutions, NACTO, the National Association of City Transportation Officials, released a guide titled Streets for Pandemic Response and Recovery. This manual was not only important at the onset of the pandemic, but decisions remain critically important as we move towards economic and social recovery. Will cities still allow outdoor seating in parking spaces? How are cities planning for changing commuting patterns? While we really don't know how commuting is going to look even a year from now, is your city going to continue to wait and see, or are they implementing solutions now? For those of you who may not be familiar with the city of Philadelphia, let's start with a high-level view. The city is located on the east coast of the United States, south of New York City, and north of Washington, D.C. Zooming in a little closer, you can see that MLK Drive is located west of our downtown, what we locally call Center City. MLK Drive parallels Interstate 76, the Schuylkill River Expressway, on the south side of the Schuylkill River for a little under 4 miles or 7 kilometers. It is located entirely within Fairmount Park and is mainly a 4-lane arterial with daily vehicular traffic of 19,500. It generally operates as a popular alternative vehicular route to the frequently congested Schuylkill River Expressway, I-76, although it's not an official incident detour route. Suffice to say, while located within a park with scenic views of the river, it's not a slow and bucolic ride on a normal day. Between the river and MLK Drive, there is a 9-foot or 2.8-meter shared use path, but due to the deferred maintenance of the pavement, it was previously a difficult run, ride, or roll. The city has just recently resurfaced that path. On the other side of the river, you'll see the Schuylkill River Trail, which parallels MLK Drive next to Kelly Drive. So these are two pictures, one on the left showing Martin Luther King Jr. Drive when it is open to traffic. You can see the 4 lanes of traffic. And then on the left side, that shared use path, 9-foot shared use path used for recreation. On the right side is a portion showing the Schuylkill River Trail. Now, looking at this picture, it does look fairly crowded, but on weekends in the spring when it's really nice, this is actually comparatively empty. So you can imagine how difficult it is to ride a bike or run through this section, especially at the onset of the pandemic when people were crowded and wanted to be outside. At the onset of COVID-19, the Bicycle Coalition of Greater Philadelphia began pushing for full closure of MLK Drive by starting a petition to send to the city. Prior to the pandemic, MLK was actually already partially closed during limited hours on weekends during the spring, summer, and autumn. The southern section, south of Sweetbriar Drive, which you saw on a previous slide, about a mile outside of Center City, reopened at noon. The reason actually goes all the way back to the 1980s when a radio DJ brought up the closure many times on his program and successfully got the city to keep MLK open for residents of the Parkside neighborhood to have easier vehicular access to the Center City and Art Museum sections of Philadelphia. Once the city moved forward with the closure, I was interested in seeing the effects on usage. If you remember, way back to the beginning of 2020, there was much uncertainty as to how the virus spread. Was exercising outdoors around other people even safe? Was 6 feet or 2 meters of distance appropriate protocol? How do we provide for proper distancing when everyone just wanted to be outside? A question I had is anybody in the city even studying this closure of MLK? I didn't want to duplicate efforts, and once I found out that no one was studying it, I set out to find some partners to assist in the data collection and analysis. Due to the methods of measuring pedestrian and bicyclist level of service, we ran into some challenges as to how we were going to analyze the results. Since outdoor activity is very dependent on the weather, I needed a way to ensure that account collection reflected a typical day. WSP tries to implement at least one sustainable development goal per project or study, analyzing closures such as MLK Drive, and using those results to advocate for more active spaces can be used to meet the goals of good health and well-being, sustainable cities and communities, climate action, and life on land. So I knew that the Highway Capacity Manual has the ability to analyze pedestrian and bicycle movements, but I've never done it as part of any study in my career. When determining the level of service for the sidewalk, the result is based on density, square footage available per person. So I wondered if the analysis was the same for a shared use path, as this would allow us to easily determine the ability to social distance. It did not, though. Analyzing a shared use path from the perspective of a bicyclist or a pedestrian is different. Once other modes are introduced to a pedestrian exclusive space, we need to look at the number of bike and passing events per hour. or a bicycle level of service score incorporating meters per minute, active passings per minute, presence of a centerline, path width, and delayed passings. For a pedestrian, a factor is not path width. So analyzing a 40-foot or 12-meter road, acting as a path didn't produce results that would really make contextual sense. Thus, our analysis would be best served from the perspective of a bicyclist on that shared use path. Given that information, we had two questions that we wanted to answer in our research. First, how did the closure of MLK affect the usage of the Schuylkill River Trail? Did it lead to providing residents a safe and accessible alternative? And what will the shared use trail level of service analysis look like for the volumes collected along MLK when applied to just the existing shared use path and when applied to the entire roadway? For the data collection, we worked with both the Bicycle Coalition of Greater Philadelphia and Imperial Traffic and Data Collection to conduct counts from sunrise to sunset at a location on the northern and southern ends of MLK. Those counts were conducted on a weekend and weekday. DVRPC, which is the Delaware Valley Regional Planning Commission, our local MPO, has permanent counters along the Schuylkill River Trail, and then the City of Philadelphia previously conducted multi-week counts along this MLK side path. As I mentioned before, the city has previously conducted counts along MLK, but the devices were only set up to count users along the side path, not the roadway when it was closed to cars. What this means is that on the weekends, when the roadway was closed to those motor vehicles, unfortunately, accurate usage data and demand was not collected. So we are only able to compare existing weekday data. On the following charts, I want to note when you see south or Schuylkill River Bridge, it's referring to one of the two pins near the bottom. So this one along MLK Drive and this one along the Schuylkill River Trail. North or Strawberry Mansion Bridge are the northern count location bridge pins. Right up here, this is the Strawberry Mansion Bridge, and this was the count that was collected by us as part of the data collection, and this is one of the locations of a permanent count or along from DVRPC along the Schuylkill River Trail. I have this fairly striking chart I just want to display first off the bat. What we found was an astounding 1,300% increase in usage on a weekday. We'll get back to how that compares to the Schuylkill River Trail during the same time period in a moment. I want to take a moment to talk about data processing and validation. Due to time constraints, the counts were conducted on days where the temperature approached 95 degrees Fahrenheit or 35 degrees Celsius. That DVRPC data I mentioned before, it also includes temperature and weather. So we use that data to normalize the counts to a 95th percentile a day, excluding cold and hot days on the lower end of the volume spectrum, and excluding surges of pedestrians and bicyclists, such as during regatta and foot race events. Since we design intersections to the peak 15-minute period of a day, I felt it was reasonable to analyze the 95th percentile usage of the facility. Expanding on the data you saw in the last slide, let's discuss how the opening of MLK to bikes and pedestrians affected the Schuylkill River Trail. One of our questions was, how did the closure of MLK affect usage of the Schuylkill River Trail? Did it lead to providing residents a safe and accessible alternative? The city's hope was that it would remove volume from the overcrowded Schuylkill River Trail, but we found it did not. Instead, recreation and commuting along the river both along the Schuylkill River Trail and MLK Drive, increased by about 6,000 people per day. So while it didn't provide more space along the Schuylkill River Trail, opening MLK to active recreation gave people substantially more space to spread out and more options. These two charts you can see right here are the Schuylkill River Trail, the south count location, and the north count location. Top graph is showing weekday users, and you can see during the pandemic, the usage actually decreased. You see the same usage in the AM and peak hours, but midday, when a lot of people were, say, working from home, they were able to get outside, maybe more locally, and enjoy the Schuylkill River Trail. Weekend users, you could see similar results here, that more people were actually outside, especially in the later part of the afternoon. This next slide shows the users along MLK on weekends during the pandemic. So obviously the Schuylkill River Bridge, the south section, is a lot closer to the populated areas around Center City. So that saw higher usage. Strawberry Mansion Bridge, though, did see quite heavy usage. If you did a bike trip, you could actually go up the Schuylkill River Trail, cross the Falls Bridge, and come back down MLK, and it takes about an hour. As a reminder, the second question was, what will a shared use trail level of service analysis look like for the volumes collected along MLK when applied to just the existing shared use path, and then when applied to the entire roadway? And since we found that closing MLK to vehicles didn't pull users off of the Schuylkill River Trail overall, we want to examine if MLK provided a safer alternative. I'm comparing two things in these charts. The LOS is if all of the non-motorized users are on that 40-foot or 12-meter roadway, and then again, if they are relegated to a 9-foot or 2.8-meter path, such as when the roadway might be open. A level of service of A means that there are very infrequent meetings of bicyclists and pedestrians. A level of service F would indicate lots of congestion. As you can see in the chart, opening up the roadway to active uses provided a more comfortable and less congested space. As you work on your projects in urban and suburban areas, consider not just minimizing delay along your streets and intersections, but utilize pedestrian and bicyclist LOS to determine if your roadway space is allocated correctly. 5 feet or 1.5 meters of sidewalk width may be enough to meet the requirement of the Americans with Disabilities Act, but is it sufficient space to avoid congestion on your sidewalks? The procedure for these methods can be found in Chapter 24 of the Highway Capacity Manual, and a calculator can be found on Federal Highway Administration's website. I'm displaying here the chart that just shows the LOS as we discussed previously. If you had any specific questions about this, please do place that in the question box. I want to talk for a moment about just some key innovations. So for the traffic counts, we used video counts. Now, I know most traffic engineers now will use video counts. Maybe 10 years ago, counts were done manually. So video is frequently the option of choice when conducting turn and movement counts, but know that it can also be used for various multimodal studies and data collection, such as in this study. Some key takeaways other than the information I provided in the previous slides about how the space provided on MLK really opened up the opportunity for more people to recreate safely just outside of Central Philadelphia, is that the NACDO guidance I spoke of earlier, it also includes post-vaccination and post-pandemic guidance. So while that manual might seem a little bit out of date, go back to that. Check to see if you're doing the things that is recommended post-vaccination, post-pandemic. The city's across the country, across the world can use these experiences to change the way that we analyze transportation facilities. As I mentioned before, consider scoping pedestrian and bicyclist LOS in more of your roadway and multimodal projects. Don't just focus on intersection or roadway level of service. As a short update, the city has since restriped MLK Drive with 1 lane in each direction, down from 2 lanes in each, but a portion of the roadway actually now remains closed for the next several years due to structural bridge concerns while that bridge is being rebuilt. And the future of MLK Drive is still being discussed within the city and the community. I'd like to thank everybody for listening into the presentation. And at this time, feel free to add some additional questions to the question box, and I'd be happy to answer them.
Thank you, Will, for a fantastic presentation. So just mentioning the housekeeping items you can find in the handouts, Will's paper, and also the presentation PDF in the handout box, and feel free to ask questions in the question box on the GoToWebinar platform. I will start with the first question. You mentioned that you normalized your data due to hot temperatures. Can you explain that process some more?
Yeah, absolutely. So I mentioned a little bit during my presentation that DVRPC has permanent traffic counters, trail counters along the Schuylkill River Trail, and in addition, actually different trails around the whole Philadelphia region. That information that's available, per hour has your number of users, bicyclists and pedestrians using that trail, and then also has the weather, whether it was partly cloudy, sunny, rainy, and then also had information about the temperature in Fahrenheit. So what we knew is that people really, the number of people driving, say at 32 degrees, is going to be the same for people driving at 50 degrees. But if it's below freezing, pedestrians and bicyclists will be less likely to go out on the trail. So what we did was I took that data and compared the specific day that we had taken the counts at MLK, where I mentioned it was, say, 95 degrees Fahrenheit, 35 degrees Celsius, and looked at the data that DVRPC had calculated. So maybe I saw that on the Schuylkill River Trail, there were 300 users, but on a 95th percentile day when the weather was nice, there were 500 users. So then I applied that factor, 500 over 300, to our MLK Drive. Would have been great to have more data along MLK Drive, several days, several weeks worth, but we were limited in the amount of data had. So I felt that was the best way to normalize the volumes along MLK as part of our analysis.
Thank you. Did you see a change in how people used the trail? Maybe less commuter bicyclists, but more recreational ones?
It's an interesting question. One of the charts I had shared was kind of showing the usage throughout the day from 5 a.m., I believe, to 9 p.m. And when I originally collected the data, I was definitely expecting to see less usage during that AM and PM peak period. The Schuylkill River Trail it's frequently used by commuters from the northwest sections of the city to commute into Center City, Philadelphia for jobs. What we found was that it didn't, and it was hard to tell without doing, say, intercept surveys or kind of more observations along the trail, is were users actually, say, starting work a little later? Were they going out or exercise before they did, since they didn't have to, say, maybe commute to the suburbs, they had extra time to exercise. And unfortunately, it's a kind of question that kind of is still outstanding, and I wish we had the information to be able to answer that. But I would say that generally we saw the higher volumes everywhere, and that people continue to use the trails even more so than they did before. I think if someone was commuting recreationally into the city, they would still want to get out and do that exercise as part of their daily routine.
Thank you. The next question is, what has been the effect on the adjacent interstate due to the closure of MLK? Has it affected traffic?
I think this is one of the questions that came up a lot during the public discussion of the closure of MLK. What was actually happening to vehicular traffic? And there's kind of two schools of thought to that. One was I took a look at some of the data. Unfortunately, we did not collect that data, didn't have the funding to collect that, and the local DOT doesn't have any permanent counters along that section of the Schuylkill River Expressway. So I wasn't able to compare, pre-pandemic to post-pandemic daily counts that might be on other locations throughout the state. But what I did do was I found an ADT, single day ADT count that was located on an adjacent park roadway. That might be a common alternative route if, say, MLK was closed and there was an incident on 76. And I pulled up that, and that was taken, I believe, in October of 2020. And what I found was that when comparing the middle of the pandemic, October, when some people started commuting back into work, several months after offices started reopening at that time, before they shut down again in the winter, was that traffic was still significantly lower on that adjacent park roadway. So it seemed that there was still that excess capacity on other roadways that was even below pre-pandemic levels. That I mentioned that I-76, just from looking at it from Google Maps, it's one of the most congested roadways in the country at that. It's a 2-lane roadway, and I think it has the highest ADT of any 2-lane expressway in the United States. Always congested, but looking at Google Maps at peak hours, I don't see much additional congestion. It's still congested, obviously. The other school of thought, though, is, MLK being a park roadway, is it appropriate for a park roadway to serve as a bypass route for an expressway? And I think that's really part of the public discussion as to, what is the future of MLK, and what is the proper usage for that roadway.
Thank you. I will take the last question. I see that you mentioned bicyclists and pedestrians a lot. Did you consider mobility devices or those on scooters or other forms of non-motorized transport?
Yes, we did. So the counts we took when we took the video counts, they really could only differentiate between bicyclists and pedestrians. So when we received the counts, that's what we saw: bicyclists and pedestrians. But the Federal Highway Administration shared use path level of service calculator, you have inputs available for adult bicyclists, pedestrians, child bicyclists, inline skaters, and runners. So what we had to do was we had to kind of parse that data a little bit. And I had somebody else within WSP assist me with this, was just to watch like an hour to a video and try to get a general breakdown of those users. So we did break it down even further. And, one of the benefits was that, MLK Drive, is coming off from Center City. There's no curb ramps, no barriers to ADA accessibility. So people in wheelchairs, motorized wheelchairs, or other assisted devices were actually able to use MLK, maybe even easier than they were to use the side path, because actually, getting into the details a little bit, but the sidewalk portion of the trail over the old bridge that they're replacing now was probably only about 3.5, 4 feet wide. So someone trying to get over in MLK would have a really difficult time to get on that shared use path, which is why the Schuylkill River Trail was a lot more popular many weekends and weekdays.
Fantastic. Thank you, Will. So we're at the end of our webinar session. Please feel free to follow up directly with Will, via the contact details shown on the screen. And I would like to thank all attendees for joining today. Thank you very much for your time. And thank you, Will, for a fantastic presentation.
Thank you. Have a nice rest of your day.